Hi, I'm Amy.
And I'm Steven.
If you've just been newly diagnosed with CML, Chronic Myeloid Leukemia, this video will give you some tips to help you with your healing process.
In general, people who are diagnosed in the chronic phase of CML have a good survival rate and quality of life, although of course everyone is different.
It can be scary when you're first diagnosed, but we hope this video gives you encouragement. Today we're going to hear from Steven.
I'm an 11-year CML survivor. I was on Tasigna for 8.5 years, and I've been in treatment-free remission for the last 2.5 years. There are many tips that we can give you today that'll help you if you're newly diagnosed. Our first tip, and one of the most important, is to take your TKI, your drug, as prescribed. I know it's not fun taking your medicine, but this is one of the most important things to having a successful, treatment plan with CML. Take your medicine. If it's once a day, take it once a day. If it's twice a day, take it twice a day. Follow your doctor's orders and do it as much as possible. That is one of the best indicators of success in your CML treatment. Keep track of your symptoms. So when you first start out taking your TKIs, you're going to have some side effects. It's important just take note of anything that happens to you. What hurts? What doesn't feel right? Does your stomach act weird? Are you tired? Do you feel headachy? Anything and everything. A lot of those side effects may go away pretty quickly and it'll be nothing to worry about. But the ones that kind of linger a little bit longer, then they might be more important that you can talk to your doctor. Sometimes the side effects will prevent you from staying on the drug, and so it's important to talk to your doctor about it because perhaps you can change your drug.
So another thing to think about as you're taking note, what's the intensity of the symptom? Does it happen during a certain time of day for you? How often these symptoms are occurring? All of those are important to take note. So, and when you first were diagnosed, I know he kept a journal of with notes as to what sorts of symptoms he was feeling, and just be aware that if you're feeling the symptom now, it could change over time. Maybe the symptom will go away, and I know some of your symptoms did go away over time. Like, for example, you were fatigued for about the first
3 weeks or so,
where he had to take a nap, but over time, his body got used to the drug. That's some of it, as well as the healing was taking place. His blood levels were back to normal, and so that does affect the symptoms that you experience.
And even then, even with those symptoms, you can try to experiment with things. I know one of the symptoms I dealt with in the beginning was sort of an achy leg, especially at night, and I found over a few days that once I started drinking more water, that feeling went away. So if you're keeping track of your symptoms, you can also keep track of things you've done that may help the symptoms, or you find that didn't do anything with the symptoms. It's important to communicate with your doctor. Your doctor wants to take care of your well-being, but can't always do that without your help. As you're keeping track of your symptoms, communicate with your doctor the ones that seem to be lingering longer. Communicate how you're feeling. Communicate what works for you. If you don't like something about your treatment plan, or if you're confused about it, ask your doctor questions. Your medical team is there for you to help you. You just need to communicate with them and talk to them. A lot of people might not want to ask questions, but this is the time to do it. If you're concerned about something, if you're unsure about something, ask the question. There's no silly question. Just ask them. If they don't have a good answer for you, they can do some research and find it. Or if they have a good answer for you, hopefully that'll put you at ease and you won't have to feel as concerned.
Well, and another thing Steven did was he not only did he talk to his doctor, he talked to the nurses. These doctors and nurses are seeing a variety of patients, and so they can kind of give you some data points as to, what we see mostly happens to our patients is this, this, and this. So for example, even with symptoms that are kind of small or you feel like maybe aren't a big deal, please go ahead and talk to your doctor about it. So for example, Steven had thinning hair, which to him is not a big deal, but he did have a conversation with his medical team about that. And do you want to talk a little bit about?
Right. I spoke to one of the nurses, and she said that, yes, she had patients that had lost some hair, but none of her patients had fully lost their head and their hair. What I was going through was common, that, it was thinning, but I didn't lose my hair, and she said I probably wouldn't. And so that was comforting to know that, okay, that I'm losing a little bit of hair, but I won't lose all my hair. I think another thing to think about with, in talking to your doctor is, as Amy mentioned, is talk to your nurses and your doctors. I like to sometimes ask the nurse who I see before the doctor the same question they're going to ask the doctor. just to see if they're kind of on the same, saying the same thing, or maybe they have a slightly different perspective on it. So if it's something that's, very important to you, consider asking the nurse the question when you see him or her, and then the doctor when you see him or her.
So the next tip we want to share with you is sort of how to deal with your emotions. So when you're first diagnosed, it's very overwhelming. It's scary. You may be feeling sad, all of these feelings. And a lot of that is hard to deal with. So in the beginning, when you're diagnosed, you're, going through all sorts of new things, right? You have to take these pills. You have to go to all these appointments. It's a lot, right? It's a lot. But over time, you get more used to taking your drug. You get used to communicating with your doctor. You get used to it, to what you have to deal with. And that'll help with your feelings over time. It'll make things a little less stressful. So right now, when you're first diagnosed, things feel very intense and might be very upsetting, but please have hope and have faith that over time that you'll get used to it and you'll adjust to the things that you have to do to keep you healthy. And we encourage you to learn your personal coping mechanisms. And so, for example, I like to journal. I like to cuddle with my cats. He and I comfort each other as well. I might say to him, I'm scared, I'm feeling scared and alone, and he'll comfort me. He'll just, it's okay. It's normal to feel that way. I like to listen to music. Or what are some things you like to do?
I like to, surf the internet and, follow sports and, maybe watch a funny video. So just things that I can get away from thinking about the CML and all the things I have to do for it. And another way I like to think about it is that, living with CML, it's a marathon, not a sprint. I think your, emotions and feelings will want you to be, have everything resolved and cured tomorrow. But that's honestly not how CML works, And so it's important to take it one day at a time and know that if you do the things that we talk about, take your TKI, keep tracking your symptoms, communicate with your doctor, you will get better and you will show improvement over time. So that's just an important thing to remember.
One last thing that we want to leave you with is this idea of what you can do maybe in the future. So right now things are maybe overwhelming and it's all you can do to just kind of keep track of your medication. But in the future, if you're thinking, well, what can I do besides taking medication to help? We want to let you know that there are lots of things that you can do to help your health beyond taking your TKI. And so we do that through what we call the Heal Everyday program. And so H stands for headspace, E is for eating, A is for activity, and L is for lifestyle. So please just have that in the back of your mind that when you're ready, please come back to our channel and watch our other videos that we have that kind of explain that in more detail.
If you want more videos on CML and healthy living, please subscribe below. Thank you for watching today. Together we heal.